Good afternoon. This is Eileen Turkel, the owner of EMTS Trans. Today we are going to go over a revision of the Soap Notes previous video. Okay, if you don't know what SOAP means, what it stands for, S is for symptomatology, O is for the objective findings, A is for the assessment, and P is for the procedure. Okay, we start out at the top and we put the patient's name, and then all caps, and then we put in all caps office note, and then the date, like 5/10/12, 5/10/12. And then, as the doctor dictates, just like this one, patient returns to the office, noting LBP, which stands for low back pain, but that's the way we do it. Radiating pain to the buttock, upper thigh on the right, but we put on the R. That's the abbreviation for right. But if we put right radiating pain, then we would type out the word right, R-I-G-H-T. Okay, now let's go into the objective findings. Myospasm noted of involved areas. He uses that a lot. Then we're going to go into the re-exam. ROM stands for range of motion, but that's how we type it. LS is for lumbar spine, but we type all caps LS. Has failed to improve appreciably, remaining decreased in all planes with greatest restriction on flexion, extension. That's how we type extension, E-X-T-E-N, lowercase. RLF is for right lateral flexion. Then DTRs is for deep tendon reflexes, but that's how we type it, DTR, all caps, apostrophe, lowercase s. And then he does the reflexes. Sometimes it's Achilles, sometimes patella. He'll tell you which one. And again, it's on the R for right. And 1/5 hypoactive. And PST, sometimes he says PST, sometimes he doesn't. And you just have to kind of feel him out and understand what he's saying. He may say sensation, and sometimes he goes into CMT, which is the muscle testing, but each time it's a little different.
Eileen, could you turn on the highlight tool so I can highlight what you're talking about as you talk?
Okay.
Yellow would be good.
Okay.
Tools, highlighter.
There.
Okay, let's highlight some of the things you were talking about, like the ROM, whatever, myospasm. Let's start here. Just the word myospasm.
Okay. Well, highlight. I don't know where your highlight is. I don't.
Well, even if it's black and white, it's okay, as long as we can see it's been highlighted.
Okay,
right.
now, okay.
ROM.
Okay, and sometimes he won't have any PST or CMT or DTR, and he'll just say all dermatones, and you don't put other because there are no other. And he'll tell you if it's the upper or lower. And then he'll say how many times a week, just like it says here, 2 to 3 times a week. Now down here is very important in the procedure, because in the procedure he doesn't always tell you. He'll give you the adjustment, like this is the adjustment, and he'll say full spine adjustment including pelvis. It's very important for the insurance company purposes, so we have to put all that in. And then he will tell you EMS and moist heat, and that's the whole thing you have to put in.
Could you highlight that now? whatever color. That's right. Keep on. Explain one more time. This is for the insurance company. What is that?
This is the EMS, a moist heat. He doesn't give that to you first. He always gives you the adjustment first. And then you must put the EMS, a moist heat first, even if you have to listen. And then he'll say neuromuscular re-education, and he means BAPS, a complete set of BAPS sport training for neuromuscular re-education.
I like that. Where's the BAPS?
And then he will say standard exercises, and this is what the standard exercises are, just like that. I'm not going to read it because it's right there on the screen. And in this case, and re-exam. Now, there might be other things he does, like, he says MRT, and he'll tell you to lumbar extensor and quadratus lumborum. And sometimes it's other things. It might be for the cervical. It might be for the shoulder. He'll tell you. And then when it's an extremity adjustment, it's a little bit different. Let's see if I could find one here that has extremity. Oh, and also another thing, they usually always do hydromassage therapy. So he'll just say usually hydromassage therapy. He'll usually say it. That's what we put in there they call it the water chair, but it's hydromassage therapy chair.
Highlight it.
Okay, let's see.
By the way, these patient names are just for an example. They're not real names. They're fictitious. And also, these notes are only for this company, right?
Yes, only for this particular one. Yeah. I don't see anything here for the extremity, but
we'll show it next time.
Okay, we'll probably have another movie and we can. Oh, here's one. Yeah, this is how we do it for the extremity. You put gentle arm, extremity of the knee, shoulder, whatever he'll tell you. And then you put in with emphasis on restoration of more normal ROM and reduction of scar tissue formation. That's what you put in when it's an extremity adjustment.
Okay. Are we finished now for this movie? Okay. This has been Lawrence and Eileen Turkel with EMTS Trans, and this is the new SOAP training video, SOAP 101. Thank you.